Hi, my name is Faith Stechschulte. I am Chief Certified Registered Nurse Anesthetist here at iOS through Buckeye Anesthesia. And I am here to educate you a little bit of what to expect on the day of your total knee replacement. Regardless if you're getting a traditional or a jiffy total knee replacement, the anesthesia is the same. You will be expected to show up about 2.5 hours before your scheduled case. This way it gives us enough time to register you in the front desk, pre-op, get an IV, and one of the anesthesia team members will come and talk to you about your medication list, your medical history, physical assessment, and so forth. And at that time, once you sign your anesthesia consent, there's no reason to stay sober. We are going to give you some sedation to kind of help cut the edge off a little bit. Things get a little blurry after that. You may or may not even remember me doing these 2 shots. And when I say 2 shots, I mean 2 numbing injections. And we are actually going to be doing 3 peripheral nerve blocks, meaning 2 injections, but 3 areas of your knee that will be blocked. So the first injection is going to be behind the knee here, and that's obviously going to cover the back of your knee. That is the posterior, what we call posterior block. The other injection is going to be kind of in the middle of the thigh here, and that is going to cover 2 blocks with 1 injection site. The first block meaning the top of your knee here, and then also the side of your knee, and that covers deep structures all within there. And you'll even notice that this side of the calf and ankle will be somewhat numb when you touch it as well. 24 hours typically. We say 24 hours is how long these blocks last. We've had some patients come back and say 1.5 days, 2 days. We've even had some say 3 days. We are going to say 24 hours, and anything beyond that, more bang for your buck. The nice thing about these blocks is that it is only sensory, meaning that you will have full motor function, full movement, full strength. You'll be able to bear weight on this, walk on this right away. You just won't have the feeling. Like I said, 24 hours is typically what we say. We will go ahead and sit you up at the side of the bed and do the spinal. I know everybody gives me a big-eyed look when I say spinal. It is not what we would think of when a laboring mother is going into labor. It's not an epidural. Very similar results, meaning you're going to be numb from belly on down, but just different spots in the back, and it is a little bit different contraindications and side effects. So I want to explain a little bit of the positioning for the spinal. The worse posture, the better for us, and that's the one and only time you'll probably ever hear a medical provider say that. But basically, the more rounded your back can be, the better. So we always say like a mad cat rounds their back. That's how we want you to be. It opens those spaces up for us. So Tamara here is going to show you the worst posture. So rounded back, slumpy shoulders, and then her chin to her chest. That's a big deal because that automatically just naturally rounds your back out. And then just your forehead is going to lean into this black chair massage table here. And I know everybody just wants to put their face in there. No, just your forehead, preferably. But we will make sure that you're nice and comfortable, and this is how we would want you positioned. Now, as the anesthesia provider, I would be behind you then, obviously, doing your injection in your back. A lot of us providers will scan your back first to see where your sweet spot is. And typically patients come in with beautiful backs, and some come in with awful backs, meaning they've had surgeries in their backs, they've had fusions, they have hardware, you name it, we see it. But we will scan your back first before and get your sweet spot. So this way it is a little bit easier for you as well. We will do your quick injection. Once we get your injection done in your back, we are going to lay you flat. Give that about 5, 10, sometimes 15, 20 minutes, and you are going to be numb from belly on down, like I said, for probably about 3 to 4 hours. Now, we will dose your spinal depending on different factors. Regardless, the first feelings is kind of some warmth in your feet and it kind of migrates up. You'll feel some numbness and tingling, and then all of a sudden it's dead weight and you're a wiggle worm in that bed and you can't move from waist down. So expect that. And once we get that spinal in, we'll head back to the OR. That's when we'll hit you with heavy sedation through your IV the whole time. So you'll be sleeping and snoring during the case. It is not considered a general anesthetic where we put a tube down. Plan B is always a general with a tube. Both are very safe anesthetics. It's just that a general is more drugs for your body to get rid of. So if we can avoid that, we are going to. Once we get your new knee, we head to recovery. You start slowly waking up. Your spinal will start wearing off and your blocks will already be in place. So you should wake up fairly comfortable. Now, if you do have a hot spot or something is aching, we can always supplement you with some oral pain medications of some sort to help with that. And then once your spinal is completely off, it is go time with your recovery. We really feel like a well-oiled machine here at iOS, where you're not just a number, that we will individually care for your needs, and we want to make sure that you're comfortable throughout your stay, not just in your pre-op, intra-op, but your post-op as well. Feel very honored for you to come. We're excited to see you and be a part of your successful journey here at iOS.